to Wimpole Street Dental Clinic. My name is Christian Mel, and in the following small video we would like to show you what you can do if an initial root canal treatment has failed. The treatment which then follows is called a root canal treatment revision. It means a repetition of the first root canal treatment with the hope that the second root canal treatment will get rid of the inflammation. So thank you very much for your time, and we hope that you enjoy the video.
Not every root canal treatment is a success. If in the procedure bacteria or tissue are left behind in the roots, or after the root canal treatment bacteria reach the inside through leakage on bad fillings or crown margins, the whole root canal system can be reinfected. This can also lead to an abscess on the bone, as you can see here with a quite big dark spot at the tip of the root. This reinfection can cause discomfort varying from dull ache to severe pain. The tooth can feel high and sensitive to bite on. Sometimes, though, one does not feel any pain at all. Then an X-ray may reveal that there's a problem with the tooth, showing the damage in the bone. With retreatment, the whole root canal system now has to be cleaned, disinfected and sealed, so the infection can heal and the tooth can stay in the mouth. The dental microscope allows a 25 times magnification of the treatment area. Here, you see the excess cavity with the old root canal filling. The arrow is pointing to a canal entrance of a canal that has not been treated or filled before, presumably holding a lot of dead tissue and bacteria. With retreatment, the old filling material now has to be removed from the canals, and all the canals, including the extra one that we've just found, have to be cleaned and disinfected. In the next picture, you see what it looks like when all the canals have been cleaned and are ready to get the seal. The root canal filling material is called gutta-perca. It's heated up inside of the tooth, inside of the canals, so the material gets soft and can be adapted to the root canal walls and guarantee a proper seal. The following X-ray shows the tooth before the treatment. You see 3 filled canals. There's not a big abscess in the bone, but the tooth has caused considerable pain to the patient. After the treatment, you see now all 4 canals have been filled, and the patient has since been out of pain. In this next case, you see as well a tooth that has been root canal treated, and you see that not all areas have been reached properly. As well, in the bone, you find quite some big infection. The next X-ray shows what it looks like 6 months after the retreatment. All the roots have been cleaned and filled up until the root tip, and the bone infection is healing. Thank you very much for your attention.